How can the cost of dental implants vary by thousands of pounds when most surgeons are using pretty much the exact same titanium screws? The implant itself doesn't explain the difference. After nearly 20 years of placing implants and rebuilding cases that failed at other clinics, I kept seeing the same pattern, and what I found completely changed how I think about implant pricing. By the end of this video, you'll know exactly why prices vary so much and what that difference actually means for whether your implant lasts a significant length of time or fails inside 5 years. Point one, the implant is not what you're paying for. When you get 3 different price quotes for a dental implant, the natural assumption is that you're getting different things at each clinic. Different implants, different materials, different quality of hardware. In most cases, you're not. The major implant systems used across the UK are largely standardized. The titanium screw going into your jaw at around £3,000 a practice and even £8,000 a practice is more often than not the same component from the same manufacturer. So if it's not different hardware, some patients assume the difference is markup or the fancier location of the clinic or the nicer waiting room, and sometimes that's part of it. But that explanation only gets you so far because the price differences we're talking about, they're not hundreds of pounds, they're thousands. And a nicer sofa in a waiting room doesn't account for that. So if the hardware is exactly the same, what are you exactly paying for? The answer to that is the reason some implants last 30 years and some fail in less than 3. Point 2, dental implants can fail. Before we go any further, here's something most people are never told by their surgeon. Dental implants can fail. The implant becomes loose, the bone around it starts to disappear. You may not have any pain, and when you go back in, the implant has to be removed. You're left with a hole where it once was, less bone than when you started, and a treatment plan that is now far more complicated and far more expensive than the first one. When that happens, most practices will tell you that these things sometimes occur, and then they will charge you to fix it. Now, this is important because the risk of failure is exactly what sits behind the price difference. Some clinics do everything required before surgery to make sure the implant lasts a lifetime. They assess the bone, they evaluate the gums, they check everything around the site before placing something permanent into it. Others do the bare minimum to get the implant placed, and when it fails, they act surprised. The price difference is not about the implant, it's about what happened before your surgery. If this is the first time anyone has explained what implant prices actually reflect, hit subscribe. Every week, I put out a video designed to give you the full picture before you make any significant financial decision about your teeth. Point 3, what a proper assessment actually involves. Before any implant goes in, 4 things need to be evaluated properly. First, the bone, not a standard flat x-ray, a cone beam 3D scan that shows the bone in 3 dimensions. How much is there, where it is, and whether there's enough to hold an implant stable long term. You cannot make that call from just a flat image. Second, the gums. An implant placed into a mouth with active gum disease fails at a significantly higher rate than one placed into a healthy mouth. A proper gum assessment measures the pocket depths around every tooth, not just the implant site. Number 3, the bite. Every time you chew, force travels through the implant. Now, if that bite is loading it incorrectly, that force becomes a problem. The bite needs to be analyzed before anything is placed. Fourth, around the site. An implant placed next to a tooth that's heading towards extraction in 18 months is not finishing your treatment, is setting up the next problem. A clinic that does all 4 before quoting you is a clinic charging you for preparation. A clinic that skips them is a clinic assuming your mouth is fine. Those are 2 completely different things to be paying for. Point 4, what proper preparation actually looks like. Let me show you what this looks like in practice. David came to me after being told by another practice that he was suitable for implants. They had looked in his mouth, taken a standard x-ray, and given him a price. He was ready to go ahead. When I took a cone beam 3D scan, the picture was completely different. The bone levels around the teeth next to the implant sites were significantly lower than a flat x-ray would ever show. Several of those teeth had no long-term future. If an implant had gone in based on that original assessment, it would have been placed into a mouth that was going to change dramatically within 18 months. We rebuilt the plan around what the scan actually showed. 6 dental implants and 7 porcelain veneers on his upper front teeth, fixed and stable. Now here is why that preparation costs what it costs. The 3D scan alone is several £100 of equipment time, the specialist hours to read it, plan from it, and build a stage treatment plan around it adds more. The periodontal assessment, the bite analysis, the treatment planning, the clinical time before a drill is ever picked up, that's where the difference in price actually lives. The cheaper clinic makes it work by skipping most of that. They place the implant and hope the mouth cooperates. Sometimes it does, sometimes it doesn't. And when it doesn't, they'll tell you these things sometimes happen. Point 5, how to tell which clinic you're in before you book anything. Ask one question. What does your pre-surgical assessment involve? A clinic doing this properly would describe a process, a 3D scan, a full gum evaluation, a bite analysis, a review of every tooth in the mouth, not just the implant site. They'll tell you that if anything is found that needs treating first, it gets treated first before the implant goes in. A clinic cutting corners would describe a consultation, a look at your mouth, maybe a standard x-ray, and a price. That answer alone tells you almost everything you need to know. A few other things worth paying attention to. If you're told you're suitable for implants in the same appointment you walked in for the first time without any scanning, that's a warning sign. If the price is given before the assessment is completed, that's another warning sign. If nobody asks about your gum history or whether you've ever been told about bone loss, that's another warning sign. A clinic that does this properly will slow you down at the start. They'll want to know everything about your mouth before they commit to a plan. That conversation will feel slower and more involved than you expected. The implant going into your jaw is the same piece of hardware regardless of what you paid. The price reflects whether a practice spent the hours required to find out if your mouth was ready to receive it. You now know what to ask before anyone picks up a drill. If you want to go deeper on what specifically needs to happen before your surgery starts, that video is on the screen right now. It's called The Dental Implant Mistake That Happens Before the Surgery Even Starts. Click it and I'll see you there.